Atrial fibrillation is a serious heart problem. The real risk of atrial fibrillation is having a stroke. When the heart is beating regularly, blood moves through the heart efficiently. When the heart is beating irregularly, blood can pool in the atrium. Blood that isn't moving starts to clot, and these clots can break loose. The aorta is the blood vessel coming out of the heart, and the first two blood vessels branching off the aorta go to the brain. A clot can lodge in an artery in the brain, and the part of the brain supplied by that artery can't get oxygen and it dies, and this is a stroke. Only about a third of people with atrial fibrillation see it as dangerous, and they are at risk for strokes and heart failure. Age increases the risk of atrial fibrillation, and so does long-standing uncontrolled high blood pressure. Diabetes, asthma, hyperthyroidism, and binge drinking all increase the risks of going into atrial fibrillation. Untreated sleep apnea isn't proven to cause atrial fibrillation, but studies show a strong link between them. Underlying heart disease, including heart valve problems, history of previous heart attacks, hypertrophic cardiomyopathy, Wolff-Parkinson-White syndrome, and history of heart surgery all increase the risk of going into atrial fibrillation. Once someone is diagnosed with atrial fibrillation, treatment plans depend on the risk of having a stroke. The CHADS-VASc risk score will decide whether you need to be anticoagulated with warfarin, aspirin, or one of the newer direct-acting oral anticoagulants, or DOACs. The score is based on congestive heart failure, hypertension, or 140/90 on 2 readings, or if someone's on blood pressure medicines. Age of 75 or greater gets 2 points. Diabetes is a point. A stroke, a prior episode, scores 2 points. Vascular disease, meaning a prior heart attack, peripheral arterial disease, or aortic plaque. Age 65 to 74 scores a point, and female sex scores a point. Anyone with a score of 2 or greater should be on anticoagulants to prevent strokes. It matters how long someone has been in atrial fibrillation and if treatments to convert to a normal sinus rhythm are successful. The treatments can include trying to get the heart back into a normal rhythm with medications, catheter ablation procedures, cardioversion, or surgery. Some people are permanently in atrial fibrillation and need to be on medications to control their heart rate and anticoagulation if they meet the criteria. The guidelines for atrial fibrillation are about 170 pages long, and you need to discuss the best course of action with your healthcare provider. Remember to call an elder. They've been waiting for your call. I'm Dr. Arne Vainio. I'm happy to be here, and this is Health Matters.